In Botswana, a health crisis is unfolding. Reuters reports that the government has declared a public health emergency as hospitals and clinics face crippling shortages of essential medicines. Patients are being turned away, and health workers say the system is under unprecedented strain. Welcome to the Voice Room News, where we break down the stories shaping Southern Africa, giving you the facts and the voices of experts and observers behind the headlines. Don't forget to subscribe, share, and stay engaged. Your awareness is your power. Botswana is facing a healthcare dilemma. Reports indicate that clinics are running short on medicines, prompting government concern. At the same time, the country recently signed a visa-free travel deal with Zimbabwe, allowing citizens to move more freely across borders. Analysts say this free movement, coupled with Botswana's provision of low-cost or free essential medicines for its citizens, has created opportunities and tensions. The Observer reports that some Zimbabweans, taking advantage of Botswana's medicine supply, have been moving medications back home for resale, adding pressure on local clinics. Botswana's President Duma Boko has proposed legalizing undocumented Zimbabweans, granting them temporary residence and work permits. Observers note this could formalize cross-border labor, but may also increase demand on public health care. A local civil society expert told the BBC, "We must balance compassion and public service sustainability." Observers point to the Botswana-Zimbabwe visa-free travel agreement signed earlier this year. While the deal has strengthened trade and family ties across borders, health experts warn it may also increase patient inflows into Botswana's clinics. One civil society group told local media, "We are proud of regional unity. But government must ensure citizens don't lose access to critical care." Across the border, South Africa faces its own public health and migration challenges. Healthy News reports growing backlash against foreign nationals using public clinics. With groups like Operation Dudula blocking access, some Zimbabweans are caught moving medicines from South African clinics into Zimbabwe, fueling local frustration. Analysts warn that scapegoating migrants ignores systemic issues. Overcrowded clinics, underfunded services, and logistical shortages are the real drivers of strain. Botswana and South Africa stand at a crossroads. On one hand, free movement agreements under SADC promote economic growth and integration. On the other, fragile state resources, especially healthcare, are buckling under the weight of increased demand. A regional analyst told the BBC, "Without coordinated healthcare strategies at SADC level, we will continue to see repeated crises across borders." The combination of Botswana's free medication policy and South Africa's crowded clinics highlights a regional dilemma. Experts say easier cross-border travel supports trade and family ties, but also tests the limits of healthcare systems. The crisis in Botswana and the tensions in South Africa reflect the same dilemma. How should African nations balance compassion for migrants with the duty to protect citizens' access to essential services? Balancing regional integration and migration with local access to essential services. As governments work on policy and enforcement, analysts urge solutions grounded in human rights, resource planning, and regional cooperation. You've been watching the Voice Room News, where we bring you facts, analysis, and the voices that matter. Stay informed, stay awake, and stay ready. Subscribe now and join the conversation shaping our future.